Hey everyone, if you are tuning in for the very first time, my name is Ben Bolter and I am a chiropractor. I'm going to talk pretty much about everything to do with back pain. I tend to do one of these Instagram lives probably once a month, hopefully, sort of the first Wednesday of the month. But this is today going to be an interesting one. We're going to talk about sort of medication and whether it has a role in back pain. Now, I do these things completely off the cuff. There's no script. I've got no notes. I've got nothing to hand. It's all stuff off the top of my head and my opinion on random different things. So what you can do is, if you have any questions or you want to drop me a message and you want me to answer anything live, then I can do that, and that is not an issue at all. So essentially, what we're going to talk about is, like I say, medication. Now, it's a real difficult one because obviously I'm a chiropractor. My job's, my skill set is my hands, and I tend not to obviously recommend drugs. I'm not a pharmacist. I'm not a doctor. I am a chiropractor, and that means that I believe in a little bit more of a manual approach to sort of dealing with, especially with back pain, because that's what I specialise in. That's what most chiropractors and osteopaths do. So when I start to talk and think about whether medication has a role within back pain, immediately my instinct is to turn around and say, no, of course it doesn't. No, I'm a chiropractor. I treat back pain and I do it manually without the use of medication, without anything specifically driving my thought process, other than getting the patient better without the need for drugs. But if I think logically about it, of course it does. I've got patients I see every day that come in, and sometimes they're in quite a lot of discomfort, quite a lot of pain. Now, when that happens, the one thing that I want to do fundamentally is get them out of pain as quickly as humanly possible. But sometimes if they're in that much pain and that much discomfort, then I have to recommend that they take some form of over-the-counter medication. And that can be anything from paracetamol, cocodamol, Nurofen, ibuprofen. It varies based on what the problem is and what the issue is. We start to get really heavy when you get onto things like Oromorph and the really heavy amitriptyline, naproxen, the things that can really need essentially prescriptions for. So I'll talk about the stuff that's more over the counter for this live video. Like I say, if you've got any questions at all about back pain or about medication with back pain, feel free to obviously let me know and I'll answer them live on air. There's obviously quite a few people sort of tuned into this, so there's going to be, if I do divert and head off down a different path, sorry, hopefully it covers everyone's questions and goes from there. So with medication, firstly, let me wrap up in a nutshell what the difference is between your pain meds and your anti-inflammatories and what the point of most of those things are. So pain medication are things like your paracetamol and cocodamol. They essentially stop you feeling pain or try to reduce it the best way possible. Your anti-inflammatories are your Nurofens and your ibuprofens. They are designed to basically reduce inflammation, and that's the difference between those two things. So depending on what sort of pain you're experiencing, depends on what drug you might need to take from an over-the-counter service. But important to note that the majority of back pain that I see particularly, there isn't an awful lot of inflammatory response. Now that might be a little bit of a controversial statement for a lot of other chiropractors, a lot of other professionals. In my experience, there's not an awful lot of inflammation regarding back pain. There's a lot of muscle spasm, there's a lot of tightness, there's a lot of angry, solid, irritated muscle tissue, possibly some ligaments, some tendons, but I wouldn't say that they are inflamed as such. Not in the same way that you'd get an inflamed ankle if you sprained your ankle. Not in the same way that you would take anything if it's inflamed. For instance, an irritated stomach, bowel, IBS type thing. So when it comes to prescribing pain medication or suggesting pain medication more specifically, my go-to thing is to always suggest the use of pain relief, which is either going to be a paracetamol or cocodamol. That is how I typically will try to use medication in treatment, because it does have a role, and it does. If you've got a patient that's in a lot of discomfort, you want to try and resolve that as quickly as possible. There's only one way to do that, and that is to use pain medication or ice. Ice is so underrated, so undervalued within inside the healthcare profession, because what it does is exactly what we're trying to do, and it reduces blood flow, it numbs a certain area, and it gives people relief immediately. So that is how I typically will try and use medication with regards to treatment plans. Now, if I start talking about a bit more about a holistic model, which there are going to be people who join into this chat who don't believe in popping pills, or don't believe in drugs, that, you know, they don't, I wouldn't say it's a belief system as such, but they don't want to take drugs all the time. And what they want to do is they want to take a little bit more of a holistic, okay, I'm going to change my diet, I can drink more, I can stretch more, I can rehab certain muscles, I can do this, I can do that. There are a whole number of things that you can do. It's whether you are getting the right combination of those things and how long those things will take to have an effect. Strengthening a muscle or trying to get a muscle to relax through stretching or massage doesn't just happen overnight. It really doesn't. It's impossible. Where the same thing can be said for taking medication on that note as well. If you were to take medication orally, unfortunately what happens is it gets filtered into the bloodstream and then it gets sent all over the body, and regardless of where, there's no pain sensors, there's nothing specific that goes straight to the source of pain. So if you've got back pain, for an example, and you take an oral medication, whether it's an ibuprofen or whether it's a paracetamol, there's no signal from that little tablet that goes into your bloodstream and then goes, right, you need to go to your back rather than going to your stomach to deal with the curry that you had last night. There's no way on earth that happens. It is simply a diluted process. As soon as it gets into the bloodstream, it becomes diluted and it just ends up everywhere. So there will be markers that will say, I need more drugs, send it to me. There'll be markers in the body that will do that. But this is where a lot of patients will turn around to me and say, I've taken paracetamol, cocodamol, I've taken ibuprofen, Nurofen, and nothing is touching it. Nothing is even getting close to resolving this pain. In that scenario, drugs probably aren't the answer, because they're not probably ended up at the right source. There's probably too much else going on in the body. There is so many other factors that can vary whether medication will have an approach or have an effect on anything like back pain or neck pain. It just unfortunately has to get diluted through the bloodstream and then get distributed as and where needed possible. So if your back is the last in that little chain of order, it's not going to end up with what it probably should. So when I use medication, when I suggest it, there's always that little thing in my head that sort of thinks, okay, right, this is what we need to do short term. It might give the patient some relief. It also might give them a bit of a placebo effect. Sometimes taking a pill or a tablet, especially if it's got Odamol or something on the end of it, can often make people feel like they're getting better. Now, I'm not ever going to discredit placebo effect. I think placebo effect is a fantastic effect because it gives people comfort and it gives people a little bit of, I think comfort is probably the best word to use actually. It does give people comfort. Whether it's actually a positive comforting effect is irrelevant. Who cares? You know, I don't care. The patient's comfortable, more happy, less pain. Who are we to argue with the placebo effect? But in the grand scheme of things, we want to make sure that the patient is comfortable. We want to make sure that nothing is really untoward. And from there, we can then manage it better. It's so much easier to treat a patient when they are in less pain and they're more comfortable and they're not experiencing that excruciating, sudden, sharp spasms. When we're trying to roll them over on the bench and trying to get them into certain positions and get them up and down off the bench, the last thing I want them to do is be screaming and shouting and be in absolute agony. If they've had pain relief or anything beforehand, I don't have a problem with that. That's not an issue for me as a practitioner. Sometimes it's an issue for the patients because they think that they're disguising what they're actually feeling, and that's going to hinder the way I treat them. Categorically, it won't. Speaking as a professional, what I get told from a patient is only half the story. What I can feel, move, and what is not working is the other half of that story. So I will put always both sides together and make it really quite, make a whole fully functioning novel of what's going on with your back pain. So what I want you to take away from this is that medication does have a place. it's not the be-all and end-all, and I don't want you to just immediately go and jump to using medication. It's something to help you feel more comfortable without it I don't want you to depend on it. I don't want you to depend on medication, because a lot of people will jump, okay, I'll have a couple of Nurofen, it'll take my back pain away, and then it'll go away in a week. If you're having pain, it means there's something wrong. So that means you need to go and see someone, speak to someone, whether it's chiropractor, osteopath, physiotherapist, even last resort, go speak to your GP if it's a back issue. But those are the things that you need to be considering. That it's an option that you can use if you need to, and it won't hinder your life. It's not going to stop your life, but if it makes you a bit more comfortable, feel free. That is not a problem on my book. So it does have a point. It does have a usage. I often recommend it if patients are in a lot of pain. A holistic approach. Now, I'm not a massive fan of the word holistic. A lot of people who know me will know that I don't really like the word holistic. I think the connotations are a little bit what I would call hippie-esque. I'm not a great believer in the whole hippie-esque sort of approach. I like science, I like facts, I like to stick to what I know and not deviate too much away from that. I'm quite willing to be open-minded towards what works for patients if they say that it works. But for me to get on board, you've got to give me a little bit more than that. I'd probably have to experience it as a therapy as well, or I'd experience something that is outside of my remit. So a holistic approach for me involves a number of things. I'd call it a well-rounded approach to healthcare, and I would think about things like potentially diet, but I'm not entirely convinced that diet has an immediate impact, like instantaneous impact, the sort of impact that I can make on someone's back pain. I don't think diet has that immediate effect. I think long term it does, but immediately not so much. But nutrition is a big one because there's anti-inflammatory markers, and we've got loads and loads of research now. I'm not even going to dive into that or even claim that I know anything about nutrition. My diet is appalling. I eat far too many jelly sweets, so I'm not going to ever start hounding people about their diets. I always suggest make sure you're looking after your diet, make sure you're drinking lots, make sure you're hydrating. Those are the things I want them to take consideration of. But then long term, massage, acupuncture, even things if you are in chronic pain every day, without sounding too negative about it all, CBT therapy, counselling, actually discussing chronic pain and how it impacts your life is such a big beneficial thing in today's world. And I think if you have experienced something for such a long time, it does have this almost disabling effect on your life, that speaking to someone just can open the door a little bit and can just sort of like give you a little bit of positive reassurance that you're A, not crazy, and B, that the pain you're getting is valid and that it is affecting your life, and you need to learn how to manage that in your daily life. Getting out of bed in the morning is uncomfortable. Are you not getting out of bed because you're in pain, or you're not getting out of bed because you're depressed? Those two things can be really sort of misconstrued, especially with family matters and going down the route of trying to understand why you're in pain. So I would say that a well-rounded approach to healthcare involves not only seeing your chiropractor, your osteopath, your physiotherapist, it also includes having an occasional massage, doing a bit of stretching, a bit of yoga, possibly Pilates, using a foam roller. All of these things are how you look after yourself long term and take a well-rounded, not holistic, approach to your back pain. That's kind of what I would consider a well-rounded, holistic approach. In the rare occasion that you have acute lower back pain, no issue at all with taking medication. To reduce pain, paracetamol, cocodamol. To reduce inflammation, Nurofen, anti-inflammatories, ibuprofen. There are stark differences between the two drugs. Make sure you get them right, and make sure that you are not just taking them willy-nilly and follow the prescriptions on the packets and the directions on the packets. Thanks for tuning in. This has been all about medication, holistic approaches to back pain, healthcare. Medication does have a role in a well-rounded approach to back pain. It should never be underwritten, and that's the be-all and end-all of it. From my opinion anyway, that's just one guy's opinion. If you have any questions, any problems, want to chat to me more about it, feel free, get in touch, drop me a message. Otherwise, this video, I will stick it on my Instagram page, and have a great night. Enjoy.